Okay, welcome back. In this video, we will continue our series on pharmacology. In this video, we'll discuss chapter number 10, Respiratory Drugs. Learning objectives for this chapter: compare and contrast the therapeutic effects of bronchodilator drugs and corticosteroid drugs. Name several types of inhaler devices and describe how they work. Describe the therapeutic effects of leukotriene formation inhibitor drugs, leukotriene receptor blocker drugs, monoclonal antibody drugs, and mast cell stabilizer drugs. Describe the therapeutic effect of expectorant drugs. Explain why tuberculosis must be treated with several different anti-tubercular drugs at the same time. Describe the therapeutic effect of drugs to help a person stop smoking. When given the name of a well-known respiratory generic drug, identify its trade name. When given the generic and trade names of a respiratory drug, identify what drug category it belongs to and what disease it is used to treat. When given a respiratory drug category, identify several generic and trade name drugs that fall in that category. When given an ending common to several generic drugs, identify the related drug category. And lastly, define the keywords and phrases for this chapter. We'll start off with a quick introduction. When we talk about respiratory drugs, these are used to treat diseases of the bronchi, the bronchioles, and the lungs. Now, these diseases could include asthma, which is a reversible obstructive airway disease. It could be bronchitis, COPD, chronic obstructive pulmonary disease, or it could be bacterial or viral infections of the lungs. We'll start off first with talking about bronchodilator drugs. Now, these are used to prevent or to treat conditions such as asthma, bronchospasms, exercise-induced bronchospasm, COPD, and emphysema. And there are various types of bronchodilator drugs. One type are beta-agonist bronchodilators. And these work by relaxing the smooth muscle that surrounds the bronchioles. So as the smooth muscle relaxes, allow the bronchioles to dilate, which allow more air to flow into the bronchioles. And a class within the beta-agonist bronchodilator drugs are drugs that are known as sympathomimetic bronchodilators. And these work by stimulating the beta-2 receptors in the smooth muscle that are around the bronchioles. And some examples of this kind of drug would be albuterol, which is also known as Proventil HFA or Ventolin HFA, arformoterol, also known as Brovana, formoterol, which is known as Formodyl aerolyzer, and also indicatorol, which is known as Arcapta, levalbuterol, which is also known as Zepanex. You can also have metoprolol. You can also have pyrbuterol, which is sold under the name Maxair autohaler, and salmeterol, which is sold as Ceravent discus. Another type of bronchodilator drugs are xanthine bronchodilators, and these directly relax the smooth muscle around the bronchioles. And they also work by stimulating the respiratory centers of the brain. And some examples of this type of bronchodilator would be aminophylline, diphenyline, which is sold under the trade name Lufilin, theophylline, which is sold under the name eloxofilin. Another class of bronchodilator drugs are the anticholinergic bronchodilators. And these work by blocking the action of acetylcholine on the muscarinic receptors in the smooth muscle that are around the bronchioles. Some examples of this type of bronchodilator would include aclidinium, which is sold under the name Tudorza, impratropium, which is sold under the name Atrovent, tiotropium, which is sold under the brand name Spiriva. Okay, now we'll talk about focus on healthcare, and we'll talk about a rescue inhaler. Now, rescue inhalers contain quick-acting bronchodilators to relieve and rescue the patient from very acute asthma symptoms. And these most commonly will contain beta-agonist bronchodilators, in particular albuterol. In this image, we have an example of a young patient being shown how to use a rescue inhaler, and this patient would use that to treat his asthma symptoms. Because when it comes to asthma, there are actually two things going on that make it very dangerous. And here's what's going on when you have an asthma attack. This is how the bronchioles should look. They're very wide open and to allow more airflow. But when there's an asthma attack, not only do you get bronchoconstriction of the bronchioles, so you're going to lessen the amount of space that the air can flow through, but on top of that, you get an excess production of mucus. Makes the passageway even stickier and even more difficult to get air in and out. That's why people who have an asthma attack, that's why they produce that wheezing sound, because it's the air trying to get past all that mucus and all that constriction. Now, in the past, asthma inhalers contained the propellant CFC, chlorofluorocarbons. Now, when CFC was banned as a pollutant under the U.S. Clean Air Act, drug companies switched to the propellant hydrofluoroalkane, which appears as the letters HFA in trade names for several bronchodilators. Now, it's common to see bronchodilators work in combination with each other. So you'll see combinations such as a beta agonist bronchodilator along with an anticholinergic bronchodilator. An example of that would be Comavent, which is a combination of albuterol and epitropium. Okay, now we'll move on to corticosteroid drugs. Now, these are hormones that are secreted naturally by the adrenal gland, and more specifically the cortex of the adrenal glands. And these work to suppress the inflammatory response of the immune system. So they help to reduce inflammation and tissue swelling or edema that's associated with asthma and other chronic lung diseases. So these are very helpful in preventing acute attacks, but they do not dilate the bronchioles, so they can't be used to treat acute attacks. They can be used to help prevent them, but they can't treat them. So these must be taken with a bronchodilator drug. Now, most drugs that fall in this category of corticosteroids are given by an inhaler device, and the dosages are prescribed by the number of puffs or actuations from the device. An example of a corticosteroid drug that's given orally is prednisone. Okay, this is a list of some common corticosteroid drugs and their trade names that they are sold under. And these drugs include beclomethasone, which is sold under the trade name Qvar, budesonide, which is sold under the name Pulmicort, cyclosinide, which is sold under the name Alvesco, flunicilide, which is sold under the names Aerobid and also Aerospan, fluticasone, which is sold as brand name Flovent, mometasone, which is sold under the name Asmanex, and also prednisolone, which is sold under the names Orapred or Pediapred. All right, now we'll talk about combination drugs. So when it comes to respiratory drugs, it's common to have multiple classes of drugs working together. Some examples of combination drugs when it comes to bronchodilators are albuterol, diphenylene, formoterol, epitropium, salmeterol, and theophylline. Now, these kinds of drugs will have a combination of one or more of the following. It could be a corticosteroid, such as budesonide or fluticasone. It may include an expectorant drug, such as potassium iodide or guaifenesin. It can also include an anticholinergic drug, such as umeclidinium. Now, some examples of these combination drugs include Anora ellipta, which is a combination of vilanterol and umeclidinium, Advair, which is a combination of salmeterol and fluticasone, Brio ellipta, which is a combination of vilanterol and fluticasone, and Comavent, which is a combination of albuterol and epitropium. Some other examples: Dulera, which is a combination of formoterol, mometasone, Lufilin GG, which is a combination of diphenylene and also guaifenesin, and Symbicort, which is a combination of formoterol and budesonide. Alright, next we'll talk about another class of drugs, Leukotriene formation inhibitor drugs, and also Leukotriene receptor blocker drugs. Now, a leukotriene is a substance that is produced by the body that is made in response to an inhaled antigen. Now, these can cause airway edema, bronchospasms, and inflammation. So when it comes to leukotriene inhibitor drugs, these actually inhibit the production of leukotrienes. An example of this kind of drug would be Xylutin, which is sold under the trade name Zyflo. And you can also have leukotriene receptor blocker drugs. And these block the activation of leukotrienes at the receptor level. So if they can't combine with the receptor, they won't have any effect at all. So it's like they're not even there. And these can also act to block the production of leukotrienes. And these are used to treat asthma, in particular. These are not used for other respiratory diseases. Some examples of a leukotriene receptor blocker drug would be Montelukast, which is the generic name of the brand name Singulair, and also Zafirlukast, which is sold under the brand name of Accolate. And now we'll talk about monoclonal antibody drugs. Now, these types of drugs keep immunoglobulin E, or IgE, from binding to receptors on mast cells and on basophils, as these cells that trigger the release of histamines. So this kind of drug is used to treat moderate to severe or persistent asthma, and this is given by a subcutaneous injection at the doctor's office. An example of a drug that would fall under this category would be omalizumab, which is sold under the brand name Xolair. Another class of drugs that we'll talk about are mast cell stabilizers. Now, these stabilize the cell membrane of mast cells, and by doing so, these types of drugs will prevent the mast cell from releasing histamine during the immune system's response to the presence of an antigen. So this will lead to preventing the bronchospasms in patients with asthma because of allergies. And this kind of drug is only effective in preventing asthma attacks, but not in treating them once they have occurred. And this kind of drug is an inhaled drug. An example of this would be cromolyn, which is sold under the trade name Intal. Now we'll talk about a drug alert. The names of all generic monoclonal antibody drugs all end with the suffix MAB, M-A-B, for monoclonal antibody. The M for monoclonal, then AB for antibody. Now with their sound-alike pronunciations, be careful not to confuse cromolyn, which is an inhaled mast cell stabilizer drug that's used to treat asthma, with cromolyn, which is a topical drug used to treat depigmented areas of the skin, such as vitiligo. So they sound the same, but they are, of course, spelled differently, and they treat completely different things. Alright, now we'll talk about another class of drugs, expectorant drugs. Now these are used to treat diseases of the lungs that produce an excessive amount of mucus. So these kinds of drugs are used to reduce the viscosity of the mucus, or sputum, so patients can more easily cough it up to get it out of their lungs, out of the body. So these are only prescribed for productive coughs. And some examples of this kind of drug, guaifenesin, which is sold under the names Humabed, or Mucinex, or Robitussin, or Naldicon, and potassium iodide, which is sold under the name SSKI. Another example of an expectorant drug is Dornase alpha, which is sold under the name Pulmozyme. Now this is an enzyme drug that's used to break apart very thick secretions in patients that have acute or respiratory disease. Now this enzyme drug will dissolve chemical bonds of the mucoproteins and thins the mucus so it can be coughed up more easily. Alright, now we'll talk about drugs that are used to treat TB, or tuberculosis. Now this condition is caused by the bacterium Mycobacterium tuberculosis, which is a gram-positive bacterium. This is spread by airborne droplets that are expelled by coughing. Now if the person's immune system is strong, the infection may remain dormant for several years before causing any symptoms at all. Alright, some quick notes about the bacterium, M. tuberculosis. It has a very unique waxy coating around the bacterial wall, which makes it very difficult to kill. And this bacterium is resistant to antibiotic drugs that are effective against other gram-positive bacteria. So when it comes to treatment of M. tuberculosis, you have to use a combination of special anti-tubercular drugs. You can't use just one. You have to use a combination of drugs. Some examples of drugs that you could use in combination with one another: ethambutol, which is sold under the name Myambutol; isoniazid, which is sold under the name INH nitrazid; pyrazinamide is another example. It could also include rifampin, which is sold under the names Rifidin or Rimactane; rifapitin, which is sold under the name Priftin; and also streptomycin. Now these combination drugs are given over a period of 9 months, so it's not something that's going to be dealt with quickly. Now in addition to those combination drugs, there are another type of anti-TB drugs that are called secondary anti-tubercular drugs. And these are most commonly used to treat a multi-drug resistant tuberculosis, or MDR-TB. This occurs when the tuberculosis bacterium has developed a resistance to the primary anti-tubercular drugs, the ones that were listed on the last 2 slides. Now, some examples of a secondary anti-TB drug would be aminosalicylic acid, which is sold under the name Pazer, and also bedaquiline, which is sold under the name Soturo. Some other examples of secondary anti-tubercular drugs: capreomycin, which is sold as the name Capistat; cycloserine, which is sold as Ceramycin pulvules; ethionamide, which is sold under the name Trocator SC; levofloxacin, which is sold as Levaquin; moxifloxacin, which is sold under the name Alvalox. There are also several types of combination drugs that are used to treat TB. This is given to treat each case of tuberculosis. And these are combined into a single capsule or a single tablet for easy dosing. And some examples of a combination drug that would help treat TB would include isonarif, which is in a combination of isoniazid and rifampin; rifamate, which is a combination of isoniazid, rifampin; also Rifator, which is a combination of isoniazid, rifampin, and also pyrazinamide. Alright, focus on healthcare. The TB bacterium has developed varying degrees of resistance to most anti-tubercular drugs. So resistant strains develop when the patient is not compliant and does not take the anti-tubercular drug for the prescribed length of time. So to minimize the chance of resistant strains developing further, anti-tubercular drugs are given in combination with one another, and patients must continue the drug treatment for a full 9 months. And because TB is such a large and challenging public health problem, patients who refuse to or who are unable to be compliant with the drug treatment may be required to participate in what's called DOT, directly observed therapy, in which the patient must go to a clinic each day and be observed while they actually take the dose in front of a medical professional to confirm that yes, they are taking the drug. In San Francisco, for example, which has the highest rate of TB on the West Coast, the Attorney General can order non-compliant patients to remain in their homes except for visiting a doctor, or even send them to jail where their treatment is continued once they get to jail. So it can be that serious of a problem if a patient is non-compliant. A quick historical note, the microbiologist Selman Waxman, who's known for discovering the antibiotic drug neomycin and also the chemotherapy drug actinomycin D, and who also coined the word antibiotic, was a professor at Rutgers University, where he studied soil bacteria. Now, he was looking for a drug that would be effective against TB, because the newly discovered antibiotic drug, penicillin, was not effective. So he and his students examined 10,000 different soil samples, looking for a substance that could kill the TB bacterium. They examined a clump of dirt that was taken from the throat of a sick chicken. Now, on it was growing the mold that would be found later to destroy the TB bacterium. So they call it streptomycin. And just before their discovery, however, a financial officer at Rutgers suggested that Waxman be fired to cut down on his expenses, stating that his work was obscure and the research would never repay the money that the university had invested in it. But after the discovery of streptomycin, Waxman was offered $10 million, and he gave the money to Rutgers, which at his suggestion used it to build a microbiology lab. I'll now talk about drugs that are used to stop smoking. Now, smoking has been linked to such conditions such as lung cancer, emphysema, bronchitis, and various other pulmonary diseases. Now, nicotine is a strongly addictive substance, and nicotine actually stimulates the frontal cortex of the brain to increase alertness and performance. This also stimulates the limbic lobe of the brain to provide pleasure. So that's why it's very difficult to quit smoking once you have started. All right, a type of drug that is used to help stop smoking are nicotine drugs, and these provide a gradual withdrawal from nicotine. So this will help to diminish the craving for nicotine. So this will supply a decreasing amount of nicotine in various forms. Some examples of these nicotine drugs would be Commit, Nicoderm CQ, Nicorette, and Nicotrol. And most nicotine drugs are over-the-counter drugs, except those that use a nasal spray or an inhaler to deliver the drug. Another class of these kinds of drugs are nicotine antagonist drugs. These are drugs that will bind to nicotine receptors, and they block them from being activated by the inhaled nicotine. And if the receptors can't be activated, then they can't work. So an example of this kind of drug would be varenicline, which is sold under the trade name Chantix. These are some other examples of drugs that are used to stop smoking. Clonidine, which is sold under the name Catapres TTS1. This is an adrenergic blocker drug, and this is used to treat hypertension and withdrawal from alcohol and narcotics. Another example of a drug that's used to help a patient stop smoking, bupropion, which is sold under the name Zyban, and this is an antidepressant drug. According to the CDC, nicotine addiction is the most common form of chemical dependence in the United States, and nicotine can be as addicting as heroin or cocaine or alcohol. About 20% of Americans smoke, and slightly more men than women. And cigarette smoking is the leading preventable cause of death in the country, accounting for 1 out of every 5 deaths. So each day, more than 4,000 people under the age of 18 try smoking, and more than 1,100 of these become daily smokers. And surveys indicate that 70% of smokers want to quit. Alright, that brings us to the end of this video on chapter number 10. We will continue our course on pharmacology for health professionals with our next video on chapter number 11, cardiovascular drugs.